Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Ben said, I am a person with type 2 diabetes with perfectly normal A1C of 6%, and I was told by the diabetes educator that I need to eat more carbs so I can go on insulin. Oh my goodness. We've got this blooper and more, so get ready for an entertaining ride.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, type 2 diabetes nutrition specialist, Dr. Jetta.
Welcome, wonderful people, to a very special episode where we dive into the wild, wacky world of diabetes bloopers. That's right. Today we're exploring some of the most astonishing, sometimes hilarious, and often concerning missteps in the diabetes advice and management that people receive. From misguided dietary suggestions to bizarre medical recommendations, we know many of our members and subscribers have seen it all, and they've shared stories with us. Why focus on bloopers? Because learning doesn't always have to be serious business. By discussing these real-life mishaps, we aim to educate and empower you to navigate the complex journey of diabetes management with more confidence and information. It's about correcting misconceptions, advocating for better care, and maybe even having a laugh at the absurdity some of the people in our community have encountered. So stay tuned. We've got a lineup of stories that will astonish you, insights that will inform you, and trusted tips that will guide you through the maze of treating your diabetes more effectively. Okay, let's dive in with the first blooper. Ben said, I am a person with type 2 diabetes with perfectly normal A1C of 6%, and I was told by the diabetes educator that I need to eat more carbs so I can go on insulin. Let's dive into this outrageous piece of advice Ben received. Holding an A1C of 6% is like hitting a bullseye in diabetes management. It means Ben is doing an outstanding job at keeping his blood sugar levels in check. Now, suggesting someone with such well-controlled diabetes should eat more carbs to justify starting insulin, that's not just counterproductive, it's reckless. Here's the deal. In managing type 2 diabetes, the goal is to stabilise blood sugar levels, often through a lower carb intake, as we often talk about on Type 2 Diabetes Talk, not to spike them with unnecessary carbs to fit the bill for insulin use. Insulin therapy is generally considered when other methods aren't enough to control blood glucose levels, and insulin therapy should really be a last resort in terms of treatment. It is not a therapy that should be used as an excuse to eat poorly. Ben and anyone else hearing similar advice, you should question it for sure. Such recommendations defy the basic principles of diabetes management. You shouldn't be getting this kind of advice because it's just plain wrong and really emphasises the issues in our system, which is why it's so important to seek out trusted professionals such as us who base advice on scientifically backed diabetes care strategies. Next up, Roz said, when diagnosed, a nurse said I shouldn't try to lower my levels because I only needed to be a little bit higher and I could go straight onto insulin. My first HbA1c was 18.7, and within 9 months I had it down to 4.9 and off metformin. Okay, listeners, this one's a doozy. Roz was initially told by a nurse not to even bother lowering her blood sugar levels because they were so close to qualifying for insulin. Now that's a head scratcher, wouldn't you agree? Starting off with an HbA1c of 18.7 is extremely high, well into the danger zone, and suggesting that someone shouldn't try to lower their levels from there is not just bad advice, it's dangerous. Roz, on the other hand, didn't just take this sitting down. Within 9 months, she dramatically reduced her A1C to 4.9 and did this while coming off metformin. This is a textbook example of why being proactive with your health is so important. The advice to avoid manage your condition effectively because it might make you eligible for insulin therapy completely misses the mark on diabetes care. The goal is always to manage and control blood sugar levels to prevent the various range of complications associated with high glucose levels and to minimize medication as much as possible, not to manipulate them to fit with a treatment protocol that isn't even appropriate. Roz's experience is a powerful reminder. Always challenge medical advice that doesn't sound right to you. Effective communication with your healthcare professionals who should be up to date with current diabetes management practices that often aren't is the key. And all I can say is good for you on being proactive, Roz. Christina said, I was told I had type 2, was given a script for metformin and told I couldn't reverse it. I decided to get a second opinion because I didn't agree with the diagnosis. Turns out I was right. I don't have type 2. I am, however, pre-diabetic, which I am working on getting rid of. It pays to get a second opinion if you feel your diagnosis wasn't right. Let me start off by saying, glad you got a second opinion, Christina. Here's another eye-opener that Christina has shared. Initially diagnosed with type 2 diabetes and prescribed metformin, she was told flat out that reversing her condition wasn't even an option. But something about that diagnosis didn't sit right with her, prompting her to seek a second opinion, and guess what? She didn't even have type 2 diabetes. Instead, she found out she was pre-diabetic. And Christina's story highlights a critical aspect of healthcare. Second opinions can be game-changing sometimes. Being labelled incorrectly with a condition like type 2 diabetes is not just a minor error. It can lead to unnecessary medications, stress, and lifestyle changes that may not be needed. Christina's proactive approach not only saved her from an incorrect medical treatment, but also empowered her to focus correctly on reversing her pre-diabetes, which is entirely possible. And this underscores a vital message. If you're unsure about your diagnosis or if something just doesn't feel right, get that second opinion. It's not about doubting professionals outright, but ensuring that your diagnosis is accurate. So good for you, Christina, for listening to your instincts and advocating for your own health. Next up, a blooper from Terry, who said, my A1C is 5.8 and I have a normal BMI. I've been working with an RD, a dietitian, but she won't give me a meal plan, and it's super hard for me to figure out which of the recipes I like that fit into the macros she says I need at each meal and for the day. It just feels like it's not working with her. I'm told I need fat, 10 grams at breakfast, 16.6 grams for lunch and dinner. Carbs, 35 grams for breakfast, 58 grams for lunch and dinner. Protein, 17 grams for breakfast and 29 grams for lunch and dinner. I just want to eat better and lower my A1C. Okay, well, Terry's experience really highlights a common issue that many people face. Overcomplication of dietary guidelines, and even worse, receiving information that can potentially harm rather than do good. For example, recommending 58 grams of carbs for lunch and dinner is a bad recommendation. It's going to keep your blood sugar and A1C levels high. Who knows where this advice has actually even come from? Because, in my opinion, there is no scientific basis for those type of recommendations. And Terry has a normal BMI and an A1C of 5.8, which is good, but he's struggling to follow the very specific macronutrient targets set by the dietitian, and it's no wonder. I mean, how much more complicated can it get being bombarded with all of those numbers? No wonder constructing everyday meals feels more like a math problem than nourishment, and treating diabetes effectively with diet and nutrition doesn't have to be this rigid, and it certainly doesn't have to be that complicated. The goal is to maintain a healthy and balanced diet that stabilizes blood sugar levels, yes, but also one that is practical and sustainable. That's the key, and that's what we help people do. Find the right eating plan that feels natural and sustainable so you can maintain it long term, or in Terry's case, even get started in the first place. So here's something more simple, Terry. Focus on one macro first, carbohydrates, and aim for a maximum of 25 grams for meals and up to around 15 for snacks if you need snacks. Include quality protein at every meal, and fat usually falls into place in its own way. It can be that simple. And by using this simple method, you'll soon start to find what works. And you can also listen to episode 6 on what to eat to treat diabetes and more on macros in episode 20. And for anyone in the same boat as Terry, macronutrient recommendations should never be this complicated. Next up, Amanda said, I am someone who suffers from bad health anxiety, and whenever I'm coming up to blood work, I get myself worked up. My last blood test recently had my fasting blood glucose at 7 or 126, but my HbA1c at 5.6. My GP still said I now have type 2 and I'm not sure what to believe, as I know stress can affect fasting blood glucose levels, but she just brushed me off. This is all very confusing. Amanda's story brings to light the anxiety that often accompanies routine blood work, especially when you're worried about something like diabetes or any type of health issue really. And her fasting blood glucose was recorded at 7 millimoles per litre or 126 milligrams per litre, which is a threshold for concern in diabetes screening, but her HbA1c was a healthy 5.6. And despite this good HbA1c, her GP declared her as having type 2 diabetes based on just one fasting blood glucose result. And this is where the confusion and the blooper kind of begins. So firstly, let's set the record straight about diabetes diagnosis. According to the medical care guidelines, a single fasting reading of 7 or 126 or above doesn't automatically mean you have diabetes. For a reliable diagnosis, you generally need at least 2 fasting readings above the threshold, or maybe you'd have a fasting reading and an HbA1c that can confirm that. And this is because many factors like stress, in Amanda's case, and even illness can temporarily elevate blood glucose levels. And Amanda's point about her HbA1c being more indicative of her overall blood sugar levels is somewhat spot on. An A1C of 5.6 is within the non-diabetic range and suggests that her average blood sugar may be quite normal. So in any case, having at least 2 tests is what's recommended by the medical care guidelines to confirm a diagnosis. So if in doubt, ask for another test. I just wanted to note Amanda's health anxiety is an important factor here. Anxiety, it can indeed impact fasting blood glucose levels or your daily readings as well, possibly causing them to spike and go higher. And when she raised this point with her doctor, it shouldn't have been dismissed. Health anxiety and anxiety in general can have real physiological effects throughout our whole body, and it's crucial for healthcare providers to consider this and acknowledge this and communicate in a manner with you that is appropriate, but also takes this into consideration when interpreting test results as well. So for Amanda, if you feel your concerns are being brushed off, it's completely reasonable to seek a second opinion. Remember, a diagnosis should be based on a complete picture of your health, not just a snapshot, and your input about how you feel is a critical part of that picture as well.
It's time to leave all the noise and confusion behind and get proven, practical solutions that really work. Understand your diabetes and exactly what to eat to keep your blood sugar stable, lose weight, and reduce medications. All this and more is possible with Dr. Jetta's scientifically proven T2 diet program. Take charge of your diabetes health and join the program today. Visit type2diabetestalk.com/programs.
Mim said, we had a dietitian, and I use the term loosely, tell us if hubby wanted to eat bad stuff to go ahead, just chew it and spit it out or throw it up. Whoa, now here's a blooper that's not just misguided, it's downright harmful. Mim shares that a dietitian, emphasised by Mim in quotes, and notice the skepticism Mim exerts around that title, advised her husband to indulge in unhealthy foods by either chewing them and then spitting them out or even throwing up after eating. Wow, this advice isn't just unprofessional, it's potentially encouraging disordered eating behaviours which can have serious physical and psychological consequences. Wow, it's astonishing. You know, it's not just about avoiding sugar spikes. It's about promoting a healthy relationship with food that's sustainable in the long term, and suggesting vomiting as a method to manage diet is even more alarming. This advice could lead to conditions like bulimia, which is an eating disorder that involves exactly this type of behaviour. So, Mim's tale is a stark reminder. Not all advice from professionals should be taken at face value, especially when it sounds as dangerous as this. Encouraging risky behaviours is never acceptable in healthcare. If you ever encounter advice like this, it's definitely time to seek trusted support from professionals who use evidence-based practices and provide care in a much different manner. And it turns out that Mim did make a formal complaint against this supposed dietitian, and she was never seen in that place again, which is understandable. And I just want to say, that's great. And if you do encounter these outrageous circumstances yourself, don't hesitate to make a complaint, because unfortunately, we see far too much of this stuff. Next up, Alana said, my past 3 HbA1cs have been 4.5, 4.7 and 4.6, and my doctor wants to not only increase my metformin, but also start me on insulin. No thank you, she said. Alana brings up a scenario that seems almost backwards in the world of diabetes care. With A1C levels like 4.5, 4.7 and 4.6, she's not just in the clear, she is excelling. These are the kind of numbers that typically have healthcare providers celebrating, not prescribing more medication. Yet her doctor wants to increase her metformin dosage and start her on insulin? That's just ridiculous. Research consistently shows us that when A1C levels are stabilised at 7% or below, the benefits of continuing aggressive medication strategies often diminish. In fact, we want to be encouraging deprescribing medication with such good A1C levels. And research shows us that deprescribing, when A1C levels are stabilised below 7%, medication often makes no difference in improving outcomes and can unnecessarily expose people to the risks of overtreatment and side effects. So in a case like this, what should be on the table instead of more medication is the conversation about deprescribing. And that's certainly a conversation recommended with A1C levels ranging from 4.5 to 4.7. Now to the next blooper. Next up, I've got a few instances of a similar situation to share. Crystal got told by the diabetes team, you can eat anything you want, just give yourself more insulin. And she said, I have so many people tell me this. Cliff also said he was told exactly the same thing by another person with diabetes. And Kay said, I'm type 2. I was told to eat what you want, just up the insulin. Here's a misconception that's not just surprising, it's dangerously misleading. Crystal, Cliff, and Kay all shared strikingly similar stories where they were advised, you can eat anything you want, just give yourself more insulin. Let's set the record straight on this. This is not sound advice for managing diabetes. Insulin isn't a magic pill, or rather a magic injection. All insulin does is lower the blood sugar. It doesn't stop the damage that high blood sugar or high insulin can do to your body. And let's just put something else straight. Managing diabetes isn't just about controlling blood sugar levels after they spike. It's about optimizing overall health through quality nutrition, which prevents those spikes in the first place. Over-relying on insulin to fix poor eating choices is a very risky strategy. And not only can this lead to weight gain, but it also increases the risk of severe hypoglycemia, potential eating disorders, and other health complications like heart disease. So it just overall is not very good advice. Focus on good nutrition and you can achieve and maintain healthy blood sugar and A1C, which minimizes the need for medication, including insulin. Catherine was told by a diabetes educator that, oh, your blood sugar is low. You better take some insulin. Let's dissect this particularly alarming piece of advice shared by Catherine. She was told by a diabetes educator that if her blood sugar is low, she should take insulin. This is a fundamental misstep in understanding how insulin works and the basics of diabetes management. Insulin is a hormone that helps to lower blood sugar levels, not raise them. So advising someone with low blood sugar to take insulin is just not correct. It's hazardous, in fact. It could lead to severe hypoglycemia, a condition where blood sugar drops to dangerously low levels and can cause symptoms like confusion, unconsciousness, and can even be life-threatening. The correct approach when experiencing low blood sugar or hypoglycemia is to consume a quick-acting carbohydrate. This could be glucose tablets, fruit juice, regular soda or candy, essentially something that can quickly raise blood sugar levels to a safe range. Of course, we don't recommend these things in a general sense, but in the case of hypos, it is important to raise levels to a safe range, hence using some quick-acting carbohydrate. In any case, this advice that Catherine received is appalling and even embarrassing, and really it just should not be happening at all because it is potentially such hazardous and dangerous advice. Okay, we've got our last blooper. And Tim said he was told by his doctor that I wouldn't have diabetes if I wasn't fat. Even my doctor told me if I would just lose weight and go down to 150 pounds, it would cure the diabetes. She told me to get bariatric surgery to take 80% of my stomach out. I said no thanks. Next time I saw her, she said, I see you like being fat since you decided not to get the surgery. Tim's story touches on a crucial issue in healthcare, the stigmatization of weight and its impact on diabetes. He was told by his doctor that his diabetes was solely due to being overweight and that losing weight, specifically getting down to 150 pounds, would cure his diabetes. His doctor even recommended bariatric surgery as a quick solution, and when he declined, she remarked that he likes being fat. This is not just unprofessional, it's potentially damaging. So first and foremost, while there is a relationship between excess weight and the development of prediabetes and type 2 diabetes, it's important to understand that diabetes is a complex condition influenced by a variety of factors, including genetics, lifestyle, and environmental components, among potentially an assortment of other things. So suggesting that diabetes can be simply cured by reaching a specific weight or by undergoing surgery overlooks this complexity, and it also, more importantly, fails to provide a supportive approach to treating diabetes effectively. The suggestion of bariatric surgery as the primary solution, without considering or discussing other methods of weight management and diabetes control, well, that's not in line with best practices which advocate for a patient-centered approach tailored to people's needs and circumstances. And bariatric surgery really should be a last solution, not something that should be considered as the first off, because we know there are other things that can be just as effective. Natural treatments like diet and nutrition, for example. The response Tim received from his doctor as well is unfortunately a classic example of fat shaming in the medical community. It's vital for healthcare professionals to offer respectful, empathetic care and to discuss all potential treatment options, including their benefits and risks, in a non-judgmental manner. So if you find yourself in a similar situation as Tim, seeking a different healthcare provider who approaches diabetes management with a more understanding and respectful manner might be necessary, because again, this stuff should not be happening and you should never be spoken to or treated in such a way. And that wraps up our journey through the wild and often wacky world of diabetes bloopers. Thank you to all our members and listeners who shared their stories, and to you for tuning in today. Each blooper we discussed not only sheds light on misunderstandings surrounding effective treatment for diabetes, but also highlights the importance of informed, thoughtful care. It is unfortunate that these things are happening all too often, and something to keep in mind is that just because a person has a professional label of diabetes educator, dietitian, or even a medical doctor, doesn't mean they are qualified to give guidance and recommendations about diabetes. A qualification of diabetes educator only provides very generic education about diabetes that's pretty limited, in fact. Dietitians can have limited knowledge to provide advice for people with diabetes because they don't have specialisation or experience around it. Medical doctors can have limited knowledge beyond medication prescription. They get next to no education in the benefits of diet and nutrition or other forms of treatment. It's just the way the system is, unfortunately, which is why it's so important to share diabetes bloopers like this, because hopefully we've empowered you to question, to challenge, and to seek the best possible guidance from trusted professionals like us who have over a decade of research and experience in the field. Remember, you are your own best advocate. If something doesn't sound right, it probably isn't. Always feel comfortable seeking a second opinion and reaching out for more information. And importantly, find trusted sources of information, like us with the information and resources we share at DMP and here on Type 2 Diabetes Talk. In the next episode, I'll be joined by Emily, DMP dietitian nutritionist, and we're diving in to cover more questions from you. If you've got a question, head to our website to leave us a voice message or email. Have a great week. Dr. Jeddah, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.